Welcome back to another episode of Med Madness, where we break down complex medical topics into easy-to-understand concepts. In today's episode, we're diving into a condition that affects millions of women worldwide, endometriosis. We'll explore what endometriosis is, why it happens, how it presents clinically, and the various approaches to managing it. Stick around to hear a real-life case study that highlights the challenges of this condition. Let's start with the basics. Endometriosis is a condition where tissue, similar to the lining inside the uterus, called the endometrium, starts to grow outside the uterus. These endometrial implants can be found on the ovaries, fallopian tubes, and even the intestines. But why is this a problem? Well, just like the endometrial tissue inside the uterus, these ectopic tissues respond to the hormonal changes of the menstrual cycle, thickening, breaking down, and bleeding. However, unlike normal menstruation, there's no outlet for this blood, leading to inflammation, pain, and eventually the formation of scar tissue or adhesions. Clinically, endometriosis often presents with a triad of symptoms: dysmenorrhea or painful periods, dyspareunia, which is pain during intercourse, and chronic pelvic pain that doesn't seem to go away. It's also a leading cause of infertility, affecting up to 50% of women struggling to conceive. Now, let's talk about management. The approach to treating endometriosis varies based on the severity of symptoms and the patient's reproductive goals. For patients with chronic pelvic pain, dysmenorrhea, or dyspareunia, the first line of treatment typically involves NSAIDs, which help reduce inflammation and pain. These can be used alone or in combination with oral contraceptives, which work by suppressing ovulation and decreasing hormonal stimulation of the ectopic endometrial tissue, thereby reducing the associated pain and inflammation. However, if a patient has more severe symptoms, needs a definitive diagnosis, or has fertility concerns, laparoscopy becomes an important tool. This minimally invasive surgical procedure allows direct visualization and biopsy of endometrial lesions, confirming the diagnosis. It also offers therapeutic benefits by removing endometrial implants, which can help relieve pain and improve fertility. For those who fail medical therapy or require more aggressive management, options like GnRH agonists can be considered. These drugs, such as leuprolide, work by suppressing the hormonal cycle, effectively inducing a temporary menopausal state that reduces the stimulation of endometrial tissue. However, this approach is generally reserved for more severe cases due to the potential side effects, like decreased bone density. Now let's bring this to life with a real case. Imagine a 29-year-old woman who's been experiencing progressively worsening cramps during her periods for the past few years. Initially, over-the-counter painkillers did the trick, but lately the pain has become so severe that she has to miss work during her periods. She also noticed that intimacy with her partner has become painful, and despite trying for a baby for over a year, she hasn't been able to conceive. After several visits to different doctors and undergoing various tests, her condition was finally diagnosed during a laparoscopy, a minimally invasive surgery that allowed the doctor to see and biopsy the endometriotic lesions scattered throughout her pelvis. This story is not uncommon. Endometriosis is often underdiagnosed, leading to years of suffering before the correct diagnosis is made. For this patient, the treatment included a combination of NSAIDs for pain management and hormonal therapy to suppress the growth of new endometrial tissue. In more severe cases, surgical options like laparoscopy can help remove the implants and improve fertility. So, to summarize, endometriosis is a condition where tissue similar to the uterine lining grows outside the uterus, causing pain, inflammation, and infertility. Management strategies vary depending on the severity of the condition. For mild cases, NSAIDs and oral contraceptives are often sufficient, while more severe cases may require surgical intervention or hormonal treatments like GnRH agonists. The key to managing this condition lies in early recognition and a tailored approach to treatment, which may include medications, hormonal therapies, and sometimes surgery. Before we wrap up, check out our pre- and post-podcast quizzes to test your understanding of today's topic. We've also created some Anki flashcards that cover the key points discussed, perfect for reinforcing your learning. Thanks for tuning in to Med Madness. Don't forget to subscribe and leave us a review if you found this episode helpful. Until next time, keep learning and stay curious. Welcome back to another episode of Med Madness, where we break down complex medical topics into easy-to-understand concepts. In today's episode, we're diving into a condition that affects millions of women worldwide, endometriosis. We'll explore what endometriosis is, why it happens, how it presents clinically, and the various approaches to managing it. Stick around to hear a real-life case study that highlights the challenges of this condition.